Welcome to lesson number 1, where we're going to tackle a Medicare overview. This is going to look at the program as a whole and dive into the parts of Medicare, the ABCs a little bit. Back in 1965, President Lyndon B. Johnson signed Medicare into effect. Medicare was primarily designed to provide health care for seniors above the age of 65. But it was also for people with a few select medical conditions such as end-stage renal disease and ALS, also known as Lou Gehrig's disease. It's important not to confuse Medicare with Medicaid. Medicare is mainly for seniors, and Medicaid is mainly for people with low income. So the next question is, who facilitates Medicare and how is the program funded? So the Medicare program is facilitated by the Social Security Administration, and it's funded by payroll taxes. So when your employer is going to pay payroll taxes, they will withhold 1.45% of your wages from you, which will go to the Medicare tax, and they will also contribute 1.45% themselves. So now we're going to take a brief look at the different parts of Medicare. Sometimes I call them the ABCs. Now I know these can cause a lot of confusion, but fear not, I will help you understand how they work together later in the course. But for right now, we're just going to go over the parts and try to figure out what they mean. I'm going to start with A and B, as they are the primary movers of the Medicare system. Then I'll describe Part D, and finally what Part C is. So Part A stands for hospital coverage and Part B stands for medical coverage. Part A covers things like inpatient hospital, inpatient mental health, skilled nursing facility, home health care, and hospice care. Now Part B is going to consist of things like outpatient hospital visits when you're not actually staying there overnight, physician's visits, this can be your primary care physician and specialists, ambulance rides, laboratory, blood work, and more things around a medical sense, not related to hospitals. Part D actually stands for drug or prescription drug. Every Part D plan has something called a formulary. It organizes drugs into a tiered system. So Tier 1 is going to be pretty generic drugs, while Tier 4 at the bottom is going to be brand name specialty drugs. And you'll also see that Tier 1 drugs will be the most affordable and Tier 4 drugs will be the most expensive. And finally, Part C is just a slang term for Advantage plan, which we'll dive deep into later, so don't worry about that right now. If you want to download an ABC's cheat sheet to easily see the parts of Medicare laid out, check out resource number 2. So now that you have a basic understanding of what the Medicare program is and what the ABCs or parts of Medicare are, next I'm going to dive into eligibility and enrollment. Who can get Medicare and when and how? If at any point during this course you want professional Medicare help, I am a licensed Medicare insurance broker. I'm trained and certified to sell a handful of the top insurance providers such as United Healthcare, Health Alliance, Humana, Aetna, Blue Cross Blue Shield, and Wellmark. If you decide to work with me, there's never a fee for my service. I'm only paid if I keep my clients, so your satisfaction is my priority. And I offer face-to-face year-round service. Also, if you haven't downloaded my 14-page fill-in-the-blank workbook, I highly recommend doing that. Just fill out the little email form on this page. I guarantee this will 10x your comprehension of the material. So whenever you're ready, go ahead and click the button below to continue to lesson number 2, where we will cover eligibility and enrollment.